Hi, my name is Dr. Loria from Loria Medical. Now, we've had patients ask us about unevenness. Let's say, for example, we do a filler treatment, right? And let's say everything's great, everything's fine. But they notice maybe a year later, perhaps, there's a little uneven spot, maybe even a little nodular appearance, right? Now, the thing with filler, let's talk about permanent filler. The filler I use that I've patented, okay? When you inject this filler, okay, the body reacts with it and generates collagen production. Okay, so now you have a lot of nice collagen in the shaft. All right, but the question is, how does collagen behave? Because there's no collagen in your shaft, but we're going to put some there to increase your girth. Right. What happens is collagen has the ability to kind of reorganize. Okay, reorganize itself and so forth. So we call it remodeling. So, for example, let me give you an extreme example. Let's say on your arm here, if you put your finger here, put pressure on there for a long enough time, you'll stimulate those cells to actually dissolve the collagen that's there. All right. If you do it long enough, you might have a little indentation there after a while. Okay. That's called remodeling. Right. That's what happens with collagen. Now, the natural penis does not have collagen. Right. Not the collagen that is in the skin, the dermis type of collagen, or the collagen that is formed from filler. So that is not present in the shaft. So now, when you have collagen formation, could there be remodeling? The answer is yes, because that's what it normally would do. That's what it normally would do. Now, the question is, how do you prevent some of that remodeling? Because some patients say, hey, I feel a little bump over here, right? Now, there's two reasons to have a bump. One is remodeling of the collagen, and two is you have unconverted filler, which is just a liquid nodule that we would poke and drain. It takes 2 seconds to fix that. So that's the easy part. But if it's truly collagen remodeling and you have like a little nodule you feel, okay, what we need to do is either inject a medicine to dissolve it or put more filler on top just to cover it, okay? That's really the two solutions, and they work very well. So patients who get any kind of unbalanced or uneven area, etc., or a little nodule, right? It's benign. It's nothing to worry about. There is a remedy. That's the point. There is a remedy to it. So either we put more filler to cover, or we poke it and just drain it because it's just unconverted filler. Okay, and that's how we handle these things. So I don't want anyone worried about that. If this were to happen, that's the remedy. Now, there's another thing we're going to introduce, and something that could help stabilize the collagen from remodeling, and that is putting on like a sleeve or a light wrap. Okay, even if it's 12 hours a day while you're sleeping, or you could just get a sleeve. They have these silicone tubes. You can just slide it on like you're sliding on a sock on your foot. That may, I'm not 100% sure, but it may actually stabilize the collagen for a lifetime, right? But you have to wear it pretty much, at least 12 hours, or just leave it on all day, right? You just like put on your socks, you put on your pants, you put on your sleeve, right? That is something we're going to introduce because we're not 100% sure if it'll work, but theoretically it could work. And in fact, I've been discussing it with patients recently, and they said, hey, if that helps, I'll do it. Okay. So I'll introduce that to patients and say, look, if theoretically we're thinking if we put like a sleeve on there, right, like a sock almost, right, like a sock, and that may stabilize and prevent collagen remodeling, right? Because remember, collagen is living tissue. If you kept your penis bent in a certain position, that joint space over time may form a crease, believe it or not, because it's living tissue and remodeling. So to prevent that, if you have a sleeve on here, it keeps everything in check, so to speak. So anyway, that's how we're trying to resolve a nodule, right, and prevent a nodule as well. Okay. If you have any questions about that, please call the office. I'll try to put some information on the website in regarding that, loriamedical.com. And hopefully we'll see you soon in the office. If you want a filler treatment, release, a sleeve, we have a whole bunch of nice things for you. Okay. So we'll chat again soon.